Hi, I'm Megan, and like you, I'm a North Carolina nurse. You know, I've been concerned about our healthcare system for a number of years, with the lack of access to primary care, the rising costs, and the chronic illnesses that lead to lengthy hospitalizations. So I'm excited to tell you about a national and now a statewide movement that will directly impact the culture of health in our North Carolina communities. A few years ago, the Robert Wood Johnson Foundation partnered with the Institute of Medicine to release a 500-plus page report called The Future of Nursing: Leading Change, Advancing Health. In this landmark report, the IOM made specific recommendations to ensure that nurses lead and shape the way healthcare will be provided in the future. And in North Carolina, we held a statewide summit of healthcare, business, and policy leaders to determine North Carolina's response to the IOM report. Then, the North Carolina Action Coalition was formed, and the coalition, using IOM's recommendations, has been busy guiding statewide initiatives that will move those recommendations into actions. A key recommendation was to remove any barriers that prevent nurses from practicing as they're educated and licensed to do. So currently, North Carolina nurses are partnering with our legislators to remove those barriers to affordable, easily accessible care. Another recommendation is that nurses pursue lifelong learning in institutions of higher education. In order to provide the nursing workforce of the future, we must have doctoral prepared nurses to educate them. A lot of North Carolina nurses serve on their professional boards, and that is so important. However, the IOM made it clear that in order to enhance care from a grassroots local policy perspective, nurses need to be active on boards that impact the culture of health in their community. So now there are national and statewide movements to help prepare nurses for board service. And I'm sure you'll be hearing more about this in the future. Finally, as the IOM made clear, and you and I have always known, nurses care for patients, their families, communities, and really all who need us. This breadth of knowledge is why the IOM urges nurses to take a leadership role in designing healthcare systems of the future. If we work alongside others as partners and leaders, we will create the healthy communities of North Carolina. Thanks so much for listening. I hope you'll go back to the email and click on the links to learn more about the future of nursing and the North Carolina Action Coalition. We would love to have you as partners, but more importantly, the citizens of North Carolina need you.